If you're thinking about getting pregnant or you're already starting to try to conceive, there are a few things I wish more women knew. Hi, I am Athena Newell, family nurse practitioner specializing in functional medicine and women's health at Stat Wellness in Charleston. One of the challenges I see in preconception care is that many women are told everything looks normal until they're struggling to conceive. And while fertility can absolutely be complex, there are several commonly overlooked factors that may affect ovulation, hormone balance, implantation, nutrient status, and overall reproductive health. And today I want to talk through some underappreciated contributors I see in my practice. Not because every woman has these issues, but because understanding them can help you ask better questions and take a more proactive approach to your health. Number 1, undiagnosed PMOS or PCOS, or something on the PCOS spectrum. So here at Stat, we do see patients fairly often that don't meet typical PCOS criteria on a diagnostic scale, but still could benefit from treatment for PCOS. Many women think PCOS only applies if they have severe symptoms, but that's not always the case. Some women might have mildly irregular cycles, but still cycling fairly regularly, mild acne, difficulty losing weight, increased facial hair, elevated testosterone or insulin resistance, and some might not fit a classic picture of PCOS. In some women, PCOS shows up primarily as irregular ovulation. And if ovulation isn't occurring consistently, conception becomes a more difficult thing to do. This is one of the first things I want to evaluate when cycles are slightly irregular. Number 2, in ovulatory cycles, just because you're having a period doesn't mean you're ovulating. Many women assume that if they're having a menstrual cycle, they are ovulating, and that's not always the case. Anovulatory cycles occur when bleeding happens without healthy ovulation happening beforehand. Signs may include irregular cycles, very long cycles, very short cycles, unpredictable bleeding, or difficulty identifying ovulation. And without ovulation, progesterone production can be significantly reduced, and without adequate progesterone, pregnancies cannot be supported appropriately. Number 3, progesterone deficiency. This is one of the most common patterns I see. Progesterone is often referred to as the pregnancy support hormone. Low progesterone may contribute to spotting before periods, shorter luteal phase, PMS, anxiety, sleep disturbances, and difficulty supporting implantation. Some women spend years thinking these symptoms are simply normal, and sometimes there's clues that hormone balance deserves a closer look. I really find that this can be the most underappreciated trouble with conception and maintaining a pregnancy and having early miscarriages. Number 4, hidden thyroid dysfunction. The thyroid and reproductive system are deeply connected. Even subtle thyroid dysfunction can impact ovulation, hormone production, energy levels, and pregnancy outcomes. Women with fertility concerns, recurrent miscarriages, family history of thyroid disease, or autoimmune conditions deserve a closer look at their thyroid health. This is especially important because thyroid dysfunction is often more common than people realize. Number 5, autoimmune conditions. Many autoimmune diseases affect women during their reproductive years. Some women may have fatigue, joint pain, hair loss, brain fog, digestive symptoms, thyroid antibody elevations. These can all present long before a formal diagnosis is ever made, and autoimmune activity can influence inflammation, nutrient status, hormonal function, and pregnancy outcomes. Identifying these issues early may provide opportunity for better support before conception. Number 6, gut health and inflammation. Your gut might not seem related to fertility, but it's incredibly important. The gut influences nutrient absorption, immune regulation, estrogen metabolism, and inflammation levels. If you're not absorbing nutrients efficiently, it becomes difficult to build the nutrient reserves needed for pregnancy. I often see women struggling with chronic bloating, constipation, diarrhea, food sensitivities, and IBS symptoms who have simply accepted these symptoms as being normal, and digestive symptoms deserve attention too. And number 7, methylation and MTHFR variants. This is one of the most talked about topics in functional medicine and one of the most misunderstood. Having an MTHFR variant does not mean you cannot get pregnant. However, methylation pathways play an important role in folate metabolism, which is incredibly important for fetal development, DNA synthesis, and cellular function. For some women, understanding how their bodies process certain nutrients may help guide more personalized nutritional support. I think this one is incredibly valuable in preconception care and something that you can find out ahead of time. Number 8, vaginal microbiome health. This is an area receiving increased attention in fertility research. The vaginal microbiome helps maintain an environment that supports reproductive health. Disruptions may be associated with recurrent infections, chronic irritation, inflammation, and potential implantation challenges. And while we still have much to learn, it's an important piece of the conversation. Number 9, nutrient deficiencies. Many women enter pregnancy already depleted. Deficiencies may include folate, B12, iron, vitamin D, choline, and omega-3 fatty acids. Pregnancy dramatically increases nutrient demands, so starting with a strong nutritional foundation can make a significant difference. And number 10, metabolic health and insulin resistance. You do not need to be diabetic to have insulin resistance, and you do not need to be overweight. And insulin influences ovulation, testosterone production, hormone balance, and fertility. And for many women, improving metabolic health creates improvements across multiple hormonal systems simultaneously. And what else is often missed? Other factors that deserve consideration include chronic stress, poor sleep, environmental toxin exposure, excessive exercising, undereating, low body fat percentages, and male factor infertility. Fertility is not exclusively a female issue. Roughly half of fertility challenges involve male factors as well. So if there is one thing I hope you take away from today's video, it's this. Fertility is about much more than reproductive organs. It's a reflection of your overall health, your hormones, thyroid, immune system, gut, metabolism, nutrients, sleep, stress, lifestyle, all contribute to a bigger picture. And the goal is to identify opportunities to increase your chances of conception if you're trying. Because the more information we have before conception, the more empowered we become to support our health and pregnancy journey. And that's exactly why I believe preconception care should be proactive, not reactive. So if you are thinking about growing your family and want a proactive root cause approach to conception health, my team would love to help. At Stout Wellness, we work with women every day to evaluate hormone health, nutrition, lifestyle factors, and overall wellness before conception so you can move into pregnancy feeling informed and empowered. Visit the link below to schedule a free 15-minute consult with our team. And thank you so much for spending time with me today. I'll see you next time.